Thank you. This next message that you're going to hear is one of the most important messages we're going to share throughout this whole ordeal. Dr. Sullivan's message, our message, goes out to those who may be infected, but those who may not be infected, but certainly affected by COVID-19 and the adverse ramifications that it's having on all of us. Her message, our message, is one of hope and help. And as we sail through this storm together, we want everyone to know that there are folks here who will deal with the troubles that maybe some are keeping inside. We want to work with you. And there's no better person to do that than Dr. Sullivan. And if you want to comment on some of the issues that are arising around the state and how we're reacting to them quickly.
Thank you, Governor. Good afternoon. I'm Dr. Jennifer Sullivan, Secretary of the Indiana Family and Social Services Administration. In addition to health care and social services, we oversee the Division of Mental Health and Addiction. Our team and incredible new leaders, Jay Chaudhry and Rachel Halleck, along with many, many partners across Indiana, have gone into overdrive to support Hoosiers in creative ways. Today, we're going to talk a little bit about what we know will be among the most crucial issues arising from the current crisis, the mental health and well-being of Hoosiers. We've seen some alarming statistics here in Indiana over the last few weeks that are indicative that our collective psyche is increasingly fragile. Gambling hotlines, which average 30 calls a month, have had 221 calls this week alone. Our addiction hotlines, which average 20 calls a week, are now averaging 20 a day. 2 agencies in southwest Indiana have reported somewhere around a 50% increase in crisis calls. 211, which normally gets about 1,000 to 1,100 calls on a big day, has been getting up to 25,000 calls a day, many related to mental health and suicidal ideations. So while the bulk of our focus has rightly been on the heroic public health and healthcare efforts to combat this pandemic, there are 3 areas we would like to highlight that will be affected both during the current crisis and our recovery from it. And yes, there will be a recovery. First, we know that people that suffer from serious mental illness and children who suffer from serious and severe emotional disturbances are at higher risk of mental health crises. We've been working closely to provide maximum flexibility, including using telehealth, to our treatment providers to ensure that crucial services for this population can continue. They've responded with amazing creativity and innovation. The ability to access mental health services without barriers like transportation or standard office hours while still being able to maintain social distancing has been one of the highlights of this response thus far. We've learned that this type of access should be available to Hoosiers, public health crisis or not. Second, we know that many Hoosiers, even those that do not have a history of mental health diagnoses, are currently suffering from an increase in adverse mental health symptoms, caused not only by the social distancing that has disrupted so much of our daily lives, but also the uncertainty of the time to come. Normally, to the extent that anything in a disaster can be normal, in a disaster, the survivors suffer a terrible loss and then work to build back from it. This slowly unfolding, constantly changing, life and livelihood disrupting crisis is unlike anything we have ever seen and is going to cause many people to experience increased anxiety and depression. Our message to Hoosiers going through this is twofold. 1, it's normal to feel this way. And 2, help and help that works is available. If you find yourself experiencing these symptoms, please seek help. You can call 211, you can contact your insurance company to find access to teletherapy, and you can talk to your doctor about whether medication might be right for you during this time. Finally, and not at all without our notice, for those with substance use disorder, this can be an especially scary time. They say that the opposite of addiction is not sobriety, but connection. And it's very easy to be disconnected right now. However, we've been blown away by the resiliency and response of the treatment and recovery communities, and we've been honored to support them during this time. 12-Step and other groups have gone virtual. Residential substance use disorder providers and recovery residences have kept their doors open. Thanks to the quick work at the Division of Mental Health and Addiction and remarkable flexibility from our federal partners, access to life-saving medication-assisted treatment has been preserved in Indiana. I'd like to introduce you to one of Indiana's many experts in mental health, Dr. Ahmed from the Bowen Center. He would like to offer the state of Indiana an introductory telehealth appointment and offer some resources for all of us as we face the coming weeks together. Welcome, Dr. Ahmed.
Thank you, Governor Holcomb, Secretary Sullivan, and Jay Chaudhary from Division of Mental Health and Addiction for allowing us to continue effective patient care via telephonic services. My name is Dr. Ahmad, and I'm so happy that you have reached out to talk about the stress and anxiety that are feeling pretty overwhelming for you right now. First, I want to say that many people are experiencing significant increased anxiety and depression recently. This is a very normal response to being in such an uncertain time. Even people who are generally calm will feel worried when they're surrounded by so much uncertainty. For those of us who are already prone to anxiety, news of a disease outbreak can significantly increase the symptoms that we are already working to learn to manage. We might begin to worry whether we will be infected, whether our friends and families are safe, and how we will handle it if we ourselves or someone we love become ill. While some worries is absolutely normal in these circumstances, for some, the spike in anxiety may start to become so much overwhelming that it's become difficult to function. That's when it is important to reach out for help. First, let me ask you a few questions to see how these things are affecting your life. Are you spending most of your time feeling worried? Are you feeling you can't seem to control your worry, even though you are trying? Are you having panic-like symptoms, shortness of breath, chest pain, muscle tightness? Are you avoiding talking to your friends and family due to your worries? Are you having trouble falling and staying asleep due to these constant worries in your head? Are you feeling emotionally out of control or burnout? Have your family and friends started mentioning that the thing your worries is getting out of control? Since you have said yes to several of these questions, it appears that seeking some help for your stress might help you feel better. The good news is there's a lot of options out there to help you. Some people feel a lot better when they're able to find a support group to manage their stress and anxiety. These could be online or organized via telehealth through a faith group or counseling center. Some people like to read self-help books to learn some technique that might help control their worries. Others find counseling with someone like me to be incredibly helpful. Therapists are highly trained to help people learn how to sort through their thoughts and organize them in a way they feel less overwhelming. Another option would be able to talk to a primary care doctor to see if non-addictive medication might help you feel less overwhelmed so that you can do things you need to do on a daily basis. You have the choice to participate in any of all these options. All of them are available through phone or internet, so you don't even have to leave your house. Community mental health center have many options for care. At the Bowen Center, where I work, I've been able to provide care via telephone. I can also prescribe medication and have it delivered directly to your door. Here are some things you can do at home that might be helpful. Make a list of things weighing on your mind. Circle the things you can control. And then list the top 3 things you can do to help move towards the more positive outcome. When you find yourself focusing on the worst possible outcome, force yourself to write down the best possible outcome as well. Tell yourself both are possible, and that the reality is probably somewhere in the middle. Step away from your to-do list, if even for a moment, and know that being task-oriented has its place, but does not always have to take priority. find an alternative. Watching a television show, taking a walk, taking a shower, reading, calling a loved one, anything you can do to take your mind off the worries for a few minutes. If you're worried about basic needs for you and your family, call 211 to see what resources might exist to help. The future feels a lot less overwhelming when we have options. Give yourself a treat. This can be anything that you love, a dessert, a moment of quiet without your family present, permission to go to bed early, wake up early. Practice setting boundaries. Say no to helping others if you are struggling to stay afloat yourself. Move your body. Try at home workout with tons of free online options out there. Zumba, yoga, plyometric exercise are great to try at home. Thank you for reaching out to us. We are here to help you, support you, and to provide resources that will get you through this difficult time. Thank you so much.
Thank you, Dr. Ahmad. I made some notes for myself, and that all rings very true to, I think, everyone sitting at this table. Really appreciate you being part of today's delivery.